Good afternoon, everybody. I hope you can hear me. My name is Sharice Magoon, and I work at UT Health here at the nursing school. And we are so happy to have you on the training today. I just want to go over a couple rules of the road before I introduce our trainer. If everybody could please mute your microphone at all times, and also make sure your video is disabled. That way you see the video of the trainer instead of all of our faces. We will take question and give some answer sessions on the chat. So make sure you can locate that. And we have scheduled time for that. So the trainer will let you know when we're gonna take a break and do question and answer. And if there's any technical difficulties, don't worry. We are recording this and we will be posting it in about a week on our www.morenarcanplease.com website. So if anything happens or you need to go back later to review it, it will be there. Also, after the training today, I will be sending you your certificate of completion and the post survey for you to complete. So without further ado, let me introduce our trainer today, who is Dr. Lisa Cleveland. She is a tenured associate professor at UT Health San Antonio School of Nursing. She is a board certified pediatric nurse practitioner and an international board certified lactation consultant with extensive expertise in opioid use disorder in pregnant parenting women, infants with newborn opioid withdrawal syndrome, and overdose prevention education. She and her team have established and are evaluating one of the largest and most productive overdose prevention and Narcan distribution programs in the country. This is made possible through a $19 million Texas Health and Human Services Commission and Substance Abuse and Mental Health Services Administration grant, which she received in 2019. So Dr. Cleveland, it's your show.
Hello, everyone, and thank you so much for joining us today. We are really thrilled to be able to provide this training for you. It is the first ever virtual Train the Trainer event in Texas, so we're really excited. Just a couple of housekeeping things. Sharice did mention that we're recording today's training. It should be posted in about a week. We really encourage you to go back and review as you prepare to do trainings out in the community. These resources are all available for you. I'm going to take you to our website in just a minute and show you where you can find handouts that you can print, where you can find our complete slide deck, which is scripted out for you, just in case you forget some of the content before you go and train. As I'm sure you know, in a typical, or you may not know, in a typical Train the Trainer, we have some time at the end of the training where we can actually do some hands-on practicing and role play. Because of COVID-19, of course, that's not possible. So we're going to do the best we can virtually. But again, we hope that you'll go back to the training video and practice as needed. We are going to take several breaks, 2 breaks in particular, 5-minute kind of water breaks. We encourage you to take that time as well to type your questions in the chat box. And when we return after the break, I'll make sure to answer those questions. We understand now more than ever this training is really needed. The American Medical Association put out a report on May 18th showing that 20 states have now reported an increase in overdose deaths since COVID-19. So we know the opioid epidemic is not going away. Everybody's attention right now is on COVID-19, understandably, but lives are still being lost. And so we're really thrilled that you want to help us train the community and to get Narcan into their hands where it's really needed. One of our own, Williamson County, appeared in that AMA report, reporting overdose deaths that were caused by counterfeit oxycodone and Xanax pills containing very high doses of fentanyl. So this is hitting us right here at home. All right. So also, if once things do go back to in-person, if that happens, we encourage you to attend a real-time Train the Trainer if you like. We would be thrilled to have you join us there as well. In the meantime, let's get started with our training. Okay, sorry about that. You gotta love technology. There's always a few hiccups. So what I wanted to bring your attention to as a trainer is we really want, and this will appear in the slide deck that you can download. when you are doing a training, we want to make sure that your attendees are able to access and complete the pre-survey. Hopefully all of you had a chance to do that today. I believe Shri sent out a link earlier. And so being able to collect this data is really important so that we can report back to the Texas Health and Human Services Commission and to SAMHSA what is being done with these federal dollars that are allowing this program to take place. So we really encourage you to ask participants to take the pre-survey. They can also go to the QR code, and oftentimes I have individuals in the audience who will scan the QR code with their phone if they have the app. The app is free, so whichever they prefer to use is just fine. With that said, I want to take you to our website very quickly. Hopefully you've had a chance to take a look at our website. Pretty much anything you're going to need to do trainings is going to be here for you. If you go under trainings, you will see that both the 2-hour training, which is what you'll be using most likely when you train in the community, and the 4-hour training, which is what we're doing today, although it most likely will not take us 4 hours. The PowerPoints are here for you to download. You can print these if you like. Again, I mentioned that they are scripted out, so you know if you're a new trainer and you kind of need that help, that's there for you. This is also where you're going to encourage folks to order their Narcan. We can do single dose, or not single dose, but single units, which contains 2 doses of Narcan, which is what's recommended. I'll show you what that looks like in just a little bit when we do the demo. You can either do individual orders or organizational orders. If you're an organization who needs a large shipment, we encourage you just to contact us through the website, and we can arrange for direct shipping of Narcan from the company, which sort of expedites things for you. The surveys are here. One more thing I want to mention about the ordering of Narcan. Please encourage your attendees when they order their Narcan, if they need a replacement dose, if they use their Narcan, there will be a place when they go to order more, it will ask them what they did with their Narcan. And it's very generic. We don't want to know people's addresses. We don't want to know names or anything like that. But what we're trying to capture is those lives saved in the community, because we know they're happening every day. Even though they can be difficult to capture, we're attempting to do that through the website, and have had some really amazing stories actually to date. So please, again, encourage folks to report any saves on the website. The surveys, again, are here. This is the same as the pre-training survey and then the post-training survey for folks to take. And then there are some additional resources that may be helpful to you or to attendees. So this website is really here for you. We encourage you to take advantage of it. We're going to look at one other thing I wanted to mention to you is we have a couple of videos here that may be helpful. We're going to watch this little animated video which we created. It's about 2 minutes long. It is available in both English and Spanish, and we designed this to be very short and easy to understand. So this is a great resource for you if you're doing street outreach and you have a cell phone and you want to just show somebody very quickly how to use Narcan. This is a great resource for you, and we'll play this at the end of the training. This training here is a little bit longer. It's 26 minutes. It's me recorded. I don't think it's nearly as interesting as the animated video, but I know folks have used this when they've wanted to do community trainings and have found it to be helpful. So again, these resources are here for you. So as mentioned, we're going to be using our pre and post survey results to report back to the state. So please include these in your trainings. And with that said, the mission of our program is to decrease the adverse impact of opioids on Texas residents through education and access to the opioid overdose reversal medication called naloxone or Narcan. The Narcan being supplied through our program and website to Texas organizations and individuals is provided by a federally funded state executed grant coordinated by us here at UT Health San Antonio School of Nursing. I have a really incredible team who are the masterminds behind this program. Many thanks to all the organizations and folks like our participants today who are being trained. We're really excited to have you here. If we can show that our Narcan program is resulting in lives saved in Texas, we can hopefully continue to supply you with free Narcan in the future. So if you use your Narcan and you save a life, please be sure to go to www.morenarcanplease.com to anonymously report the life you saved and order your replacement Narcan for free. Help continue this community effort to stop opioid overdose deaths in Texas. Here's what you can expect from the training today. Following this training, you will be able to train others to explain how opioids work and their differences and similarities, define 3 major risk factors for opioid overdose, recognize the signs of an opioid overdose, respond to an opioid overdose and use Narcan, and describe the law in Texas that allows us to carry Narcan. Overdose death is now the leading cause of injury death for U.S. adults, with 170 Americans dying every day from overdose. Of these overdose deaths, almost 68% involve a prescription or illicit opioid. From 1999 to 2017, nearly 400,000 people died from overdoses involving an opioid, including both prescription and illicit opioids. This rise in opioid overdose deaths occurred in 3 distinct waves, which we're going to discuss in pretty great detail. The first wave began with the increased prescribing of opioid painkillers in the 1990s. Overdose deaths from prescription opioids, both natural and semi-synthetic opioids such as methadone, began to rise and has significantly increased by 1999. The second wave began in 2010 with rapid increases in overdose deaths involving heroin, which resulted from greater regulation and decreased prescribing of opioid pain relievers. As individuals became dependent on prescription opioids and prescribing became more restricted, they unfortunately turned to illicit opioids such as heroin, which can be less expensive and easier to obtain than black market pills in many communities. The third wave began in 2013 with significant increases in overdose deaths involving synthetic opioids, particularly those containing illicitly manufactured fentanyl. This market continues to change, and illicitly manufactured fentanyl can now be found in combination with heroin, counterfeit pills, and stimulants such as cocaine and methamphetamine. And we're going to talk more about fentanyl in just a little bit. There are some concerning concerning statistics on opioid use in our country. Every 19 minutes, someone dies from the misuse of a prescription medication. Every year, more people die from a prescription overdose than car accidents. Half of all Americans are on prescription medications, and on average, each of those people have 5 different prescriptions. Let's take a look, talk a little bit more about the epidemic. This graphic shows the changes our country has experienced over the past 20 years. And I find this to be pretty impactful just to look at this. The red areas depict regions greatest impacted by opioid-related fatalities. And as you can see in 1999, only 1 area in the country was in red. Notice the difference when you compare this to the 2016 map. Opioid use disorders aren't only a public health concern in the US, they're also a global health concern. According to the World Health Organization, there were an estimated 27 million people who experienced opioid use disorder in 2017. A recent statistic showed that there were 19.7 million Americans with substance use disorders, and almost 2 million of those had an opioid pain reliever use disorder. We know that those who develop an opioid use disorder may move on to use heroin since it can be more potent, less expensive, and more readily accessible. In 2017, there was an estimated 652 individuals with a heroin use disorder. As mentioned, overdoses have become the leading cause of unintentional death in our country. Multiple organizations have that are listed here on this slide, have said that opioid use disorder is the epidemic of our generation. It is believed that our generation will be the first to have a shorter lifespan as a result. So how did we get here? As mentioned, the opioid crisis actually began late in the 1990s when pharmaceutical companies convinced prescribers that prescription opioid pain relievers were non-addictive and then aggressively marketed them as effective in relieving both acute and chronic pain. This led to a large increase in prescribing of opioid pain relievers, widespread diversion of these medications, and misuse of them. As a result, opioid overdose deaths began to dramatically increase, which is the first wave of overdose death we discussed a few minutes ago. So what is known is that roughly 21 to 29% of individuals who use prescription opioids for chronic pain misuse them, taking more than prescribed. Also, up to 80% of individuals who use heroin first misuse prescription opioids. Further, opioid overdose deaths increased 30% between July of 2016 and September of 2017 in 52 areas of 45 states. And the Midwestern region of the U.S. actually experienced a 70% increase in opioid overdoses during the same time period. It's important to note that there are numerous social determinants that fuel the U.S. demand for pain relief and multiple pathways to opioid dependence. Further, this demand for opioids has created a market for synthetic forms of fentanyl. This demand has also created an underground opioid market that is highly unpredictable in content and potency, something that's not likely to change soon. So something I get asked often is, what is the difference between an opiate and an opioid? This can be a source of confusion for many people. And to answer the question quite simply, there really isn't much difference. In general, the word opiate is an older term that's often used to reference a naturally occurring form of opium, such as morphine, made directly from the poppy plant. The name opioid is a newer term that may be used to describe any type of opium product, naturally occurring as well as synthetic and semi-synthetic forms. Synthetic meaning that the active ingredient is created chemically. All opioids created equal? That's another question I hear. So opioids are the same in that they may either come from the opium poppy or are synthetically created, such as fentanyl. So they have similar properties to the opium poppy. They are also the same in that they affect the same areas in our brains. When a person takes opioids, it travels in their bloodstream and targets the central nervous system, where it binds to mu receptors. Mu receptors are responsible for activating a series of events in our central nervous systems, causing our bodies to respond to the opioid. One of the dangerous side effects of these drugs, especially when taken in large amounts or doses, is that they can depress the respiratory center of our brains, thereby causing respiratory failure. Fortunately, there is a life-saving drug called naloxone, or the trade name Narcan, that can reverse the effects of opioids. Opioids are different in that they have varying concentrations and strengths and durations of action. With that said, you can see that opioids are available in differing strengths, but they also can have differing durations in their effect. On this slide, notice how the effects of fentanyl, while strong, may only last about 2 hours. Compare this to the very long-acting methadone, which can be used to treat opioid use disorder. This is another reason it's so important for a person to seek medical attention following a Narcan overdose reversal. It's possible that the effects of the opioid they took could outlast the 30 to 90-minute effect of Narcan, at which time they may again begin to experience respiratory depression. Prescription opioid use can lead to heroin use because it is less expensive and easier to obtain, as we mentioned. 4 out of 5 individuals who use heroin started out misusing opioid painkillers. They then turned to heroin as an alternative. According to the American Society of Addiction Medicine and the National Institute on Drug Abuse, the highest overall increase in heroin use has occurred in young individuals between the ages of 18 and 25. Heroin may be available in different forms with differing strengths. Here are just a few examples, and this can really vary throughout the country, by different location. So let's talk about fentanyl just a little bit. Fentanyl has received a lot of attention in the press, and for good reason. It is a dangerous medication. So fentanyl is a potent synthetic opioid drug approved by the Food and Drug Administration for use as an analgesic or a pain reliever and an anesthetic. This drug was intended to be used for cancer pain or for short-term use during major medical procedures. But as you can see, when it is used illicitly, these drugs are dangerous and can cause mortality. Fentanyl is approximately 100 times more potent than morphine and 50 times more potent than heroin as an analgesic. Most of the fentanyl that we are experiencing on the streets of Texas is illicitly manufactured. We are also now seeing an even stronger drug called carfentanil, which is a large animal tranquilizer and 10,000 times more potent than morphine. If you look at the bottles on the right side of this slide, you will see the amount of heroin that might cause an overdose compared to the middle bottle, which is the amount of fentanyl that might cause an overdose. This image really helps to illustrate the potency of fentanyl. Now, the bottle on the far right contains the even more potent opioid we mentioned called carfentanil. As you can see, this drug is even more potent than fentanyl. You can also see the differences in the strength of these drugs by looking at this image of pennies containing doses of both fentanyl and carfentanil that have equal potency. According to the CDC, fentanyl deaths have increased by 540% over the past several years. In an article posted by the National Public Radio, increased trafficking of the drug and increased use are both fueling the spike in fentanyl deaths. Individuals who produce, sell, and distribute opioids find fentanyl much easier to produce than other opioids. Unlike the poppies needed for heroin, which can spoil due to weather or a bad harvest, fentanyl is a synthetic combination of chemicals that is more potent than many opioids. Fentanyl is more likely to cause an overdose than heroin because it is so potent and can be deadly in very small amounts. Additionally, fentanyl can also be mixed with other drugs such as cocaine and methamphetamine, which means that some people may be exposed to fentanyl without even knowing it. As mentioned, when an opioid is taken, it travels through the bloodstream and targets the central nervous system where it binds with immune receptors, causing a response. One of the side effects of taking opioids is its ability to create and maintain an analgesic effect. This is its intended use, which is what makes opioids effective pain relievers. However, opioids can also alter a person's mood, giving them a sense of euphoria. This is a main side effect that reinforces the use of opioids among individuals who have an opioid use disorder. There are several risk factors that place individuals at increased risk for overdose that really need to be recognized. So when an individual has reduced tolerance following a period of abstinence, so as an individual's body becomes used to the effects of opioids, the brain will try to self-regulate, meaning that it will take more and more of the opioid to get the same effect that's desired. And so when somebody has been practicing abstinence, that tolerance may be gone. This can occur for an individual who is just leaving treatment. If they were detoxed and have been off of opioids for a while, they can be at very high risk for overdose. This also can occur with individuals newly released from incarceration. Their overdose rate has been found to be 40 times higher than the general public, especially during the first 2 weeks after they're released from incarceration. Knowing this, many jails have now begun to issue Narcan to individuals of opioid use disorder who are being released from incarceration in an attempt to prevent these deaths. We've worked with our Bexar County Jail to make sure inmates are leaving our jail with Narcan if they so desire. We've also worked with Harris County and a couple of other counties. Another risk factor is using opioids in combination with other sedatives, such as alcohol or benzodiazepines, such as Xanax, which can be very dangerous. These combinations can multiply the respiratory depression caused by opioids and contribute to overdose death. Social isolation is another risk factor. People who use opioids when they're alone are at much greater risk of dying from an overdose since no one else is present to call for help or to use Narcan to reverse the overdose. For those of you who are going to be working with communities where you are educating people who use drugs about Narcan, you're going to really want to talk to them about not using alone. Always have somebody there with you just in case. And then also another risk factor is just a variation in potency of street drugs. As we mentioned, strengths may vary based on purity of the opioid and other ingredients used to cut the drug. And so another recommendation for people who use drugs is if they are purchasing from a new supplier is to be very cautious because you don't always know what you get. So what is the difference between addiction and dependence? The National Institute on Drug Abuse states that addiction encompasses both a mental and physical reliance on a given substance. Addiction is marked by a change in behavior caused by the biochemical changes in the brain after continued substance use. Substance use becomes the main priority regardless of the harm that it may cause to the individual or others. And addiction may cause people to act irrationally when they don't have the substance they are addicted to in their system. Dependence is actually a part of addiction. Physical dependence, we kind of mentioned is earlier, is when the body is trying to regulate, and so as that tolerance increases, there's that need for more and more of the drug to get that same effect. And in the case of opioids, to prevent physical withdrawal, which can be very, very unpleasant. So in other words, it is possible to be dependent on morphine without technically being addicted to it. This is especially true for people being treated chronically with opioids for pain, such as that associated with terminal cancer. They may become dependent on these drugs. So if the drug is stopped, they may suffer withdrawal symptoms. However, they are not compulsive users of morphine. So I want to take a minute and talk about stigma. Stigma is such an important component when we talk about substance use disorders, including opioid use disorder. These are some of the most highly stigmatized conditions we know of. Stigmatization can result in the labeling of individuals or groups as inherently different, thus enabling discriminatory behaviors against them. These behaviors can ultimately deny stigmatized individuals of full social acceptance, thereby reducing their opportunities and fueling these social inequities. Stigma serves as a well-documented global barrier to health-seeking behaviors and engagement in health care. Conversely, those who have a strong social support are less likely to discontinue treatment and are more likely to be engaged in treatment. This is ultimately what we want to achieve for individuals who experience substance use disorders. Breaking down barriers to stigma is one way to help individuals feel connected to their family and community in order to help them achieve recovery. It's important to understand that recovery will be a lifelong effort individuals will have, regardless of what substance use disorder they have. In fact, substance use disorders in general are considered chronic health conditions, much like diabetes. For individuals who have chronic health conditions, periodic relapse can occur. For example, someone who has type 2 diabetes will need to manage their blood glucose through lifestyle changes and pharmacologic treatment. However, they may go through periods of relapse where they have difficulties managing their blood sugar. Despite this, it is important they continue to receive support and encouragement. This is the same with individuals who have substance use disorders. There may be circumstances that make recovery difficult at times. However, through continued support and access to life-saving resources and services, recovery is possible. So there is a multi-pronged solution to this opioid crisis. First, decreasing the number of opioids being prescribed to the minimum needed after painful procedures such as surgery or dental work is critical. It's important that we look for other alternatives to pain management. For example, non-steroidal anti-inflammatory medications such as Motrin, which can be more effective in managing chronic pain than opioids anyway. Properly disposing of prescription opioids no longer needed is also important. There are many prescription take-back days one can participate in to get rid of unneeded opioids, and you can inquire about these in your communities. Another solution is access to evidence-based treatment. Fortunately, when talking about opioid use disorder, there are several FDA-approved medications available that can significantly improve recovery success. These medications include methadone, buprenorphine, oftentimes referred to as Suboxone or Subutex, or naltrexone, which has the brand name of Vivitrol. Unfortunately, this isn't true for many other types of substance use disorders. One thing that's important to note, though, is that prescribers should avoid discontinuing prescribing of opioids to individuals who have become dependent without ensuring that they have access to needed treatment services. While we want to limit the number of prescription opioids in our community and prevent individuals from developing a problem with them, it's also dangerous and frankly unethical to cut someone off who has become physically dependent without providing access to treatment services. Doing so may force those who have become dependent to look for other and possibly illicit opioid sources, which can increase their risk for overdose. Another solution is co-prescribing of the life-saving medication Narcan with all prescription opioids. Many states are now requiring prescribers of opioids to co-prescribe Narcan with every opioid prescription to ensure anyone at risk for overdose, which is truly anyone taking opioids, has access to Narcan. Finally, community-wide access to Narcan is a must. This doesn't just mean law enforcement or EMS, but also friends, family members, and significant others of people who use opioids. And I know that's why y'all are here today, is to help us get this training in Narcan out to those community members who need it the most. So we've mentioned Narcan several times, but what exactly is it? Narcan is a life-saving medication. It comes in an injectable form, and I'll show you some pictures towards the end of the presentation of the different forms that Narcan can come in. This injectable form is often referred to by its generic name, which is naloxone. It's now also available as Narcan nasal spray, which is what anyone who goes to our website, any Texan who goes to our website to order will receive, is the nasal Narcan spray. Narcan can actually reverse an overdose by reversing the respiratory depression that is a side effect of opioids. Narcan essentially pushes opioids off the opioid receptors in the body. It then attaches and remains there for 30 to 90 minutes, not allowing the opioids to reattach, and the individual essentially wakes up. It's kind of like getting the wrong key stuck in a lock. In this graphic, you can see how opioids fit perfectly on the opioid receptors in the brain. When this happens, opioids can relieve pain and cause a sense of euphoria. But if the opioid dose is too high, they can also interfere with the brain's respiratory center, causing inadequate respirations or complete respiratory failure. In this graphic, you can see how Narcan, which has a higher affinity for the opioid receptors than opioids, can displace or basically bump the opioid off the receptor and reverse its effect. It's important to keep in mind again, though, that the effect of Narcan may only last 30 to 90 minutes. That's why it's important for an individual who has experienced an overdose that was reversed with Narcan seek immediate medical attention following. This is because many forms of opioids, again, have a longer duration than the 30 to 90 minutes that effect of Narcan. And once it wears off, the individual can then again experience life-threatening respiratory depression. So just a very brief history on Narcan, which is actually on the World Health Organization's list of essential medications. Narcan was developed in 1961 to reverse another side effect of opioids, which is constipation. It was then patented in 1969, and the injectable form was FDA approved for overdose reversal in 1971. In 2008, the initial experiment with community distribution of naloxone occurred with a generic form of Narcan. Pre-filled syringes of injectable naloxone were distributed with atomizers placed on the end, allowing the medication to be administered intranasally. Community-based programs, primarily syringe services programs, began distributing injectable naloxone, resulting in a significant number of overdose reversals among drug users. This demonstrated that non-traditional first responders, lay people such as friends and family members, were more than capable of administering naloxone and saving lives. In 2014, community access to naloxone gained fast-track FDA approval in response to the growing opioid crisis and increasing rates of overdose deaths. Finally, in 2015, Narcan nasal spray, which Texas residents can now order for free from our website, gained fast-track FDA approval to help address the U.S. opioid crisis. This is what the Narcan you order from morenarcanplease.com website will look like when it arrives. Each order will include a box with 2 doses of 4 milligram Narcan nasal spray. This is important since it's always recommended you carry 2 doses of Narcan just in case one isn't enough and you need to re-administer in 2 to 3 minutes. You'll want to protect your Narcan as much as possible from extreme temperatures. Recommended temperature is about 40 to 80 degrees being ideal. So leaving it in your car in the hot Texas summer probably is not a good idea. The manufacturer tells me that the temperature shouldn't affect the strength of the Narcan, but it could cause some evaporation of the medication, meaning less Narcan in each dose. Another really good reason to always carry 2 doses. But Narcan will only reverse the effects of opioids, not other types of drug overdoses. This slide lists some common opioids and includes both fentanyl and illicitly manufactured fentanyl. It's really important to note that if someone is overdosing and you're not sure what they took and it turns out not to be an opioid, Narcan will not hurt them. It just likely will not help them. Narcan is quite safe and can even be used with children. It has also been used to reverse overdoses involving canine police officers that have inhaled large doses of highly potent opioids. So again, Narcan will not reverse overdoses caused by other types of medications like those listed on this slide, such as alcohol, Valium, cocaine, and methamphetamine. I often get asked why we're able to carry and administer Narcan in Texas without a prescription. In answer to this question, there actually is a statewide standing order that went into effect following the passing of the Texas Senate Bill 1462 in 2015. This legislation says that Texans who carry and administer Narcan in good faith in an attempt to save a life are protected from criminal and civil liability, as well as professional disciplinary action for those who are licensed healthcare professionals. If you'd like to know more about this legislation, you can replay the recording of this this training later on and pause and read through this. You should also find this on the internet. Well, I think it seems obvious why it's important for traditional first responders, such as law enforcement, the fire department, and EMS to carry Narcan. What about you? Why should you carry Narcan? Why should the individuals you're going to be training carry Narcan? There's actually a really good reason. And over the past several decades, more than 250,000 people have experienced an opioid overdose. 77% of these occurred outside of a medical setting. With that said, we're going to take just a 5-minute water break. Everyone can stretch, and I encourage you to please keep your questions coming. We'll address some of those when we return from the break.
Hi, Dr. Cleveland. This is Sharice. We have some questions. If you would like me to start reading those off to you.
Please, yes, please do, Sharice.
Okay.
Thank you.
Sure. The first one says, can the general population order Narcan through the website?
Yes, you certainly can, as long as you are a Texas resident and you have a Texas address. Each state has their own funding, and so that's why we are limited to only residents of Texas.
And next question, it says, can nonprofit agencies request Narcan?
Yes, you absolutely can, and we will send it to you for free.
Okay, and then we have one, it says, hi, you mentioned that after the person comes through from an overdose, they can still overdose. So it's best to get them medical help. Would that just depend on how much they may have in their system, or does it just differ from person to person?
So that's a really good question. It probably it's kind of both. So depending on what they took, so if it's a very long-acting opioid, and sometimes it's hard to know what somebody took, particularly if they're using illicit opioids. So if they took something that has a very long duration of effect, it can actually outlast the effect of Narcan. So if they took something that lasts for, let's say, 8 hours, the Narcan is really only going to, keep them covered for about 30 to 90 minutes. And there could be some variation in how people metabolize the Narcan, metabolize the opioid. So that's why we say always seek medical attention, just to be on the safe side.
All right, we have two more questions. So
Okay.
the next one is, if prisoners are provided Narcan when they are released, and since it's not self-administered, what type of training given to them to pass along to family, caregivers, and companions?
That is a great question. Here in Bexar County, we are actually looping the training video, the little animated, it's like 2-minute video to show them how to use Narcan. We're looping that through waiting areas, just about any place that there's a TV, and we're encouraging other county jails to do the same as an opportunity to educate.
Okay, last question is, how long is the dose good as in expiration date?
So your box when you order will have an expiration date on it. It's typically about 18 months, give or take. But check your expiration date. I will say that there have been many reports of expired Narcan still successfully reversing an overdose. So if you come upon an overdose and you realize, oh my gosh, my Narcan's expired, if it's all you have, use it anyway. It likely will still have effect. If your Narcan expires, contact us. We can try to arrange for a pickup of it, but please, by all means, order a new dose from our website.
One last question.
Okay.
It says, is the injection or nasal better?
Um, they both are very effective. Um, it kind of depends, I think, on what the individual is most comfortable with. If you are somebody who is very comfortable using, drawing up medication into a syringe and injecting it, the injectable form is less expensive. I'm told it doesn't act quite as quickly as the nasal Narcan, since the nasal Narcan is absorbed through the mucous membranes of the nose, which is very quick. The nasal Narcan is more expensive. However, we do get a reduced rate. And so I hope that answered your question. That wasn't a real straightforward answer, but it kind of depends. Is that the last question?
That's it.
Okay, well, great. Well, we will have another opportunity for you towards the end when we set up for the demonstration, where you can type in more questions and we'll address those. So let's discuss some facts versus myths. I think we've hit a couple of them, but we want to address those, I think, a little bit more completely. So we've mentioned fentanyl several times during this training, and fentanyl definitely has infiltrated our country's illicit drug supply, some areas more so than others. And has been largely responsible for that third wave of overdoses we discussed. With that said, there have also been a lot of myths and misconceptions circulating about this drug. Fentanyl is used all the time for surgical procedures, and it is actually a very useful drug when used appropriately. And an overdose won't occur from simply being near the drug or even touching it. If you think about surgical procedures, we have people who work in anesthesia who handle fentanyl every day. However, there could be a potential concern if a large amount of this drug was released into the air and an individual inhaled a significant dose. But this scenario really is pretty highly unlikely. If someone comes into contact with fentanyl, they should use the same standard precautions they would use with any potentially hazardous material. First thing you want to do is wash your hands thoroughly. As mentioned, being in proximity to the drug will not result in opioid toxicity, even for a drug such as carfentanil, which again is 10,000 times stronger than morphine. It must first travel through the bloodstream, then bind to the mu receptors and target the central nervous system in order for this drug to exert its effect. Therefore, having brief incidental contact will not likely cause opioid toxicity. Now that we've debunked the myths, the truth is, if inhaled, powdered fentanyl can lead to adverse effects. However, this form of transmission is less likely to occur than brief incidental skin contact. If your skin comes in contact with fentanyl, it is recommended again that you thoroughly wash the exposed area as soon as possible. Doing this will decrease your risk for adverse health effects. With that said, it's really important as you go out and teach the community. And I've worked with law enforcement a lot. There's a great deal of fear around fentanyl, around the whole topic of fentanyl. And again, for good reason, it can be a very dangerous drug. But I think it's really important that we're arming the community with facts and not hysteria. So we want to be able to prevent false narratives from negatively impacting individuals with substance use disorders, and I have seen that happen. The implications of misinformation may cause first responders to internalize falsehoods. Therefore, it is important to provide information that accurately describes the potential risk and dangers concerning opioids. If you are a first responder and you are responding to a call where powdered fentanyl is present, it is recommended that you wear gloves and avoid any actions that may cause the powder to go airborne. Additionally, personnel are encouraged to follow department guidelines if the scene contains large amounts of fentanyl. If exposed, the individual needs to take these proper steps. Inform others that they have been exposed to prevent further contamination. Avoid touching your eyes, nose, mouth, or other skin areas to decrease further contamination. Wash the affected area as soon as possible with cool water and soap. Do not use hand sanitizer. This is really important because hand sanitizer contains alcohol, which can actually increase the absorption of fentanyl through the skin. And then again, follow your department guidelines for decontamination of clothing or personal protective equipment if there's contamination. Further, those who are responding to a fentanyl overdose should follow these steps. Administer Narcan or naloxone. If Narcan is not available, initiate rescue breathing if you've been taught basic life support and you feel comfortable providing it. You may need to even initiate CPR until EMS arrives. Use standard safety precautions as you are initiating basic life support or CPR. So let's talk a little bit more about the underlying physiology of overdose and how it occurs. First, when an individual has taken too high a dose of opioids, the respiratory center in the brain can begin to shut down. Their breathing significantly slows and ventilation may become inadequate. Over time, their breathing stops, depriving their vital organs, such as the brain and heart, of needed oxygen. As the heart is deprived of needed oxygen, its ability to pump blood to the vital organs is affected, circulation of the blood ceases, and tissue death begins to occur. Depending on what the person took, overdose can be very rapid. So based on what they took and how they took it. So say perhaps somebody is injecting drugs and they get fentanyl, that type of overdose could occur very rapidly. But depending on, if a medication was taken orally, overdoses can occur over anywhere from 1 to 3 hours. But there are symptoms that we need to be aware of to help identify individuals who are overdosing. And it's going to be really important that you teach community members how to identify these and respond to them. During the initial stages of overdose, the individual may appear as though they were extremely drowsy. You can notice snoring. You may notice snoring or loud breathing. And I'm going to play you a video in just a few minutes of an actual first responders responding to an overdose and giving Narcan. And you will hear this very loud snoring as the individual's respiratory system is shutting down. It's a very distinct sound. Some people misunderstand it as snoring or sleeping, but it's a very different sound. During this stage, individuals may still be somewhat arousable or conscious, and we're going to do some role play for you in just a little bit, do a demo, and we'll kind of show you that. As overdose continues, the individual will become unresponsive. So efforts to try to awaken or shake them will not work. They will have shallow breathing, which may include a gurgling sound. Their skin will be noticeably pale or even blue, particularly their lips and fingernails. This is because there is less oxygen circulating in their bloodstream. Their pulse may also be weak or absent. Finally, a fatal overdose occurs when breathing stops completely and there is no pulse. Interestingly, the majority of opioid overdoses are actually witnessed. This provides an opportunity for intervention and a need to have Narcan readily accessible to prevent death, especially for high-risk populations. Unfortunately, one of the issues in providing assistance is a fear that witnesses may be arrested if they call 911. As a result, witnesses may leave or abandon the individual instead of rendering aid. This is the worst possible response to an overdose and may actually contribute to the death. So what is the cure for an overdose? It's actually oxygen. An individual can be helped for a while with respiratory support through rescue breathing and supplemental oxygen, but to truly reverse an opioid overdose, Narcan is needed. Okay, give me just a second. I'm going to share my screen with you, and we're going to, because I want us to watch this video.
Let me pull him out. Get him on the ground. Get him on the ground. Sir.
What's his medical history?
I don't know. He just picked him up 10 minutes ago.
You just picked him up?
Yeah, he's like, I need some money. Can you put me to work? And I said, yeah.
He's got a pulse. He's breathing, so.
Hey, grab gloves.
He's not breathing. I don't know if it's drug related. Give me a flashlight. I can't see his eyes. Yeah, they're pinpoint. Go left nostril. Five to 6 Narcan deployed in the left nostril.
He's mine?
Excuse me?
He's mine?
No, it's just the one.
This one?
14, 15. Let's do. They might get here before
No,
you.
it doesn't go there. It's right there.
Go ahead. Try to put it on them. There you go. There we go. Hold on. All right. Take it off. Got a pulse, barely breathing. You just sort of take a breath. His eyes are in one. There he is.
So this is a video that you can share when you do your community education. I think there's something really powerful about hearing the respirations. I think once you hear that, it's hard to forget. I think the other important part of this video is also that minutes passed before EMS was able to arrive. Had law enforcement not had Narcan with them, that could have been the difference between life and death. Okay, so now that you're going to be carrying Narcan, what do you need to do if you come upon a person experiencing an overdose? There are a couple of easy steps we'll review that you can follow, and then Brianna and I are going to do a demonstration in just a few minutes. First, tap the person's shoulder and try to get their attention. You can say, "Hey, are you all right?" or firmly yet gently rub your knuckles up and down their breastbone and try to wake them, similar to what you saw in the video. If they respond but still don't seem quite all right, call 911. Place the person in the rescue position on their side, which we will demonstrate, and remain with them until help arrives. If, on the other hand, there's no response after a few seconds, don't wait any longer. Remember, every second counts when someone's not breathing. Call 911 and take action while you're waiting for them to arrive. Next, you want to gently place the person on his or her back and lift the chin to clear the airway and make breathing easier. Then, and this is the most important step, grab your Narcan, open the box, and take out one of the 2 nose sprays and peel it open. Insert it into the person's nostril all the way until your fingers touch the edges of their nostril. Once you've done that, press the plunger and release the entire dose into the nostril. Remember, the nasal mucosa is very vascular and will readily absorb the Narcan. The person does not need to be breathing for Narcan to be effective. Next, roll the person on their side while waiting 2 to 3 minutes for the Narcan to take effect. If you're trained in basic life support and feel comfortable doing it, you can also provide rescue breathing for the person while you wait. Keep in mind, when they wake up, they may be very disoriented and frightened. Also, if they're opioid dependent, the Narcan may put them into withdrawal, which is not typically life-threatening, but can be really unpleasant. They may feel really sick and not happy with you, but that's okay. They're alive. If 2 to 3 minutes pass and the person still hasn't woken up, you can deliver another dose of Narcan in the other nostril and continue rescue breathing. In rare circumstances, it may be necessary to deliver a 3rd dose if the person still has not awakened 3 to 4 minutes after the 2nd dose, but hopefully by that time, help will have arrived. Once the individual is conscious and EMS is on the way, there are a few things to consider. Let the individual know what happened. Let them know that they overdosed and you gave them Narcan. As mentioned previously, because Narcan reverses the effects of opioids, the individual may have withdrawal symptoms. Additionally, Narcan, again, only works for somewhere between 30 to 90 minutes. If they took a large dose of opioids, these drugs may outlast the effects of Narcan, making them susceptible to experience respiratory depression again. It is important that these individuals get medical attention so that healthcare providers can continue to monitor them closely. Remember, if you suspect someone has overdosed, it's important to receive Narcan as soon as possible. Important that they receive Narcan as soon as possible. Narcan will reverse the effects of the opioids, allowing the person to breathe again. Narcan can be administered safely because it is not addictive and does not have psychoactive effects. But giving Narcan again can cause withdrawal symptoms. And these can include diarrhea, abdominal cramping, anxiety, agitation. People just don't feel well at all when they're experiencing withdrawal. Again, if an opioid or an opiate is not present in the body, the Narcan will have no effect. Remember, when we're talking about overdose, every second of response time matters when someone's not breathing. Opioid-induced respiratory depression can lead to permanent brain damage in as little as 4 minutes, and death can occur in as little as 4 to 6 minutes. Consider this and the fact that the U.S. national average EMS response takes about 7 minutes, meaning that the time from calling 911 to help arriving can take up to 7 minutes. For individuals living in a rural setting, this response time can be up to 14 minutes. So again, when someone isn't breathing, every second matters. And this is particularly important for those of you who will be doing trainings in rural communities. It's absolutely essential for people to have Narcan. Also consider that 80% of overdose reversals are not performed by EMS or law enforcement. They're done by people just like you who may be community members, peers, or family members of someone in need of help. Further, one half to two-thirds of heroin users have experienced at least one non-fatal overdose. And once someone has experienced an overdose, it is much more likely to happen again and to be fatal. And 80% of people who use drugs have observed an overdose. This is just one more reason why we should all be carrying Narcan. So let's talk a little bit about the different forms of Narcan that are available. Through our website, again, you'll receive the nasal Narcan, but if you were to get Narcan from another place, it may come in a different form. The current slide shows a pre-filled syringe, which contains 2 milligrams and 2 milliliters of Narcan. It comes with an atomizer that you can attach to the syringe. The Narcan contained in the vial must be screwed into the syringe before it is administered. Once everything is assembled, the tip of the atomizer, which is the yellow part, is attached to the pre-filled syringe. You will need to insert that into the individual's nostril. Only half the dose is to be administered. The remaining dose is to be administered in the other nostril. I'm sorry, the little atomizer is the white thing, not the yellow thing's a cap, but the white thing. We looked into providing this form of Narcan through our Narcan program. However, the atomizer is not FDA approved, so we are not allowed to spend federal dollars on it because it's not approved. This is what the Narcan you order from our website will look like when it arrives. Each order, again, will include 2 doses of 4 milligram Narcan nasal spray. This is important since it's always recommended, again, that you carry 2 doses of Narcan just in case one isn't enough and you need to re-administer in 2 to 3 minutes. This is another very fancy form of Narcan. This one actually is an auto-injector. It administers the Narcan intramuscularly and will deliver 0.4 milligrams of Narcan. We're going to take just another 5-minute break while we set up for the demonstration. Please keep your questions coming. We can address those when after the demonstration when we return.
Okay, we're ready to take some questions now.
Okay, great.
Okay, there's going to be quite a few. So the first one is there an end date to your funding to be able to provide free Narcan?
As of right now, we have received word that we'll be receiving funding for an additional 2 years. And this is really all based on what the federal government allocates. So as of right now, we're okay.
Okay, next question is, how long before you administer the second dose of Narcan?
It's typically recommended about 2 to 3 minutes to wait, and that can probably feel like, I've been told it feels like the longest 2 to 3 minutes of your life, but it does take just a little while to take effect.
And another question is, has TDCJ requested Narcan or any other parole or probation supervision offices?
I believe the answer is yes. If you would like to email me offline, we can look at our database. We keep a database of who all we ship Narcan to, and we can provide that information for you.
Okay, next question is it true that Narcan will not hurt a child if accidentally sprayed in their face?
That is true.
And the next one is, why is the auto injector only a 0.4 milligram dose while the nasal spray is 4 milligrams?
I'm not sure I can answer that. I do know that the nasal Narcan is intentionally stronger than your typical Narcan dose, and that is because of fentanyl. You know, we need to make sure it's strong enough that it can reverse fentanyl.
Okay, next question. After you administered the Narcan and the individual wakes up, what if he refuses to seek further treatment? What are your options?
You know, you can't force people to do what they don't want to do. I mean, I think you can talk with them, say, you know, hey, you almost died. This is really serious. You need to get medical attention, but ultimately the decision is theirs. And that does happen. It happens all the time. People are administered Narcan, they wake up, they're scared, and you know, they take off, they don't feel good. But you know, every encounter like that is an opportunity. It's, you know, addiction is a very, very difficult disease.
Okay, this is the last one on this series. It says, you mentioned Texas temperature. Are there any other safety precautions to take for safe storage or carrying of Narcan, like in our office building, house, carrying in our bags, etc.?
It should be fine. It's just the heat is the big issue. And that would be true of very cold climates too. just protecting it from the temperature.
That was the last question.
Okay, great. So are we ready for our demonstration?
Yeah.
Okay, I'm going to put myself on mute. Ready? Okay.
Can you hear us?
So I have my friend Brian here who's helping us. And so, Brian, are you okay? You don't look good. Hey, man, are you okay? Hey, wake up. And so then as Brian becomes unconscious, we would want to move him to a flat surface. And so Brian here is going to help me. We're going to move him to a flat surface where he'll be safe. And then step 2 was to angle his head back so that his mouth is slightly open, which allows for him to more easily breathe. Then you're going to take your box of Narcan and open it up. And inside you will have your 2 doses, just like what you saw in the illustration. You're just going to peel it open and take out your dose of Narcan. These are demonstrators, so they're yellow. They contain no medication. Yours will actually be white, so don't let that concern you, okay? So you're going to take your little Narcan with the plunger on the bottom, like this. You're going to insert it in Brian's nose until your fingers touch the very edge. And then you're going to push the plunger and insert the entire dose into the nostril. And then you want to put the person in the rescue position, which is on the side. With him and wait for your 2 to 3 minutes. If he's not breathing at all, if you feel comfortable doing CPR, you can do rescue breathing for him. You have already, hopefully by this time, called EMS, which would be one of your first steps, is to alert EMS or ask somebody else to, hey, call EMS, and then get your Narcan out. So if we've waited the 2 to 3 minutes and he's still not breathing, you would take your other dose out and do the same thing in the other nostril to the edge of the nose and just insert the entire dose, like such. And hopefully by then, EMS has arrived and there's help on the way, or he's begun to breathe again. Okay? All right, we will put him back. Okay, and so we're back. Were there questions that came up during the demo that we might want to address right now?
Somebody said he doesn't look very good, the patient.
And let me tell you, he's really heavy, in case you couldn't tell.
So there was a few questions.
Okay.
It was, if the Narcan is expired, will it still be effective?
So yeah, we touched on this earlier. Ideally, you don't want for your Narcan to be expired, and there's no reason for it to be, because you can order new Narcan from our website for free. But with that said, if you come upon an overdose and you realize your Narcan is expired and it's all you have, use it anyway. There have been some reports of Narcan that is expired that has been just as effective in reversing an overdose.
Next question is, should you notate the time Narcan was administered?
Yes, I think that'd be very helpful, especially, you know, like I said, people say that's the longest 2 to 3 minutes of your life. And so just kind of notating it, kind of calming your nerves. Okay, we're still within that 2 minutes or whatever. You know, I think that would be very helpful. And it would be helpful for EMS as well when they arrive.
Next question, why is it important to do each side of the nose if using more than one Narcan?
It's just recommended by the manufacturer. It may have something to do with the absorption. You know, they just recommend that if you have to re-administer, to go to the other nostril.
And the next question is, at what point do you stop administering Narcan? Like, does an overdose of a non-opioid look similar to an OD of an opioid?
One more time, Trace. Let me just
Okay.
think about that for a second.
Oh, okay. Let me read it.
Yes.
Let me see if I can read it a little better. It says, at what point do you stop administering Narcan, comma, like, does an overdose of a non-opioid look similar to an OD of an opioid?
I'm not sure I can answer that question with great certainty because it would depend, I think, on what the individual took. So, you know, you've called EMS. Hopefully by the time you've administered 2 doses, they've arrived. I will tell you that our EMS partners on another project we're working with have informed us that when they arrive upon a scene and somebody is unconscious and not breathing, one of the first things they do is administer Narcan. And if that has no effect, then they kind of have ruled out, okay, it's probably not an opioid. Let's continue down our algorithm. Is this something cardiac? Is this something else going on? So I hope that helps.
Okay, so the next one, is there any liability for an agency that gives expired Narcan if it is all there is to give?
I think that would be up to your agency. And we have had agencies say, we can't keep expired Narcan, and that's fine. Give us a call. We'll try to arrange for pickup and replacement, but I think that would probably rely more on your organization's policies and procedures.
And then someone asked, go ahead and repeat what the signs of an overdose are.
So it would start with, so you may have noticed in the demonstration, Brianna is a very good actor. It may start with somebody who appears very sleepy, and they kind of call it like nodding off, where they're kind of in and out of consciousness. And then slowly, the breathing becomes less and less as the respiratory system starts to shut down. You may hear that loud snoring breathing we heard in the video, again, because the respiratory system is starting to shut down. And then eventually there's no breathing. And then with the no breathing, eventually that leads to cardiac arrest.
And here's a question about the website. Does the website have info on number of lives saved by Narcan administered each month?
I don't think we post the numbers. We do post testimonials of people who have reversed overdoses. Those are always a big round of cheer when we get those in. We do have the numbers because we have to report those to the state. And again, you know, it's pretty easy when we work with agencies like law enforcement, because they will report. They're really good about reporting to us, and they do report numbers to us. It gets a little bit more difficult when you're in the community because people are scared, and I get that. You know, they're really afraid that if they do report, hey, I saved a life, that they're going to get in trouble, which is not the case. I mean, we would never post somebody's name or location or anything like that on the website. So it gets a little trickier when you're in the community, and that's why we have the website. And when people come to the website to order the Narcan, we say, hey, what did you do? You know, are you replacing a dose? What did you do with the last dose? If you administered, did you save a life? Did you give it to somebody else? Just trying and as hard as we can to track where this Narcan is going so that we can show that it's making a difference.
That was the last question on this round.
Okay, all right, good. So let's continue on. We are almost done. I want to make sure that you have our contact information. There's my phone number. Best way to reach me is probably via email. Again, these slides are posted for you on the website. You can print them out. You can use them for your trainings. You can call me. Ms. Ashley Emmerich is my project lead and the real brains behind this organization. She is incredibly helpful as well. Some of you may know Mark Kinsley and Charles Thibodeau of the Texas Overdose Naloxone Initiative. They are an awesome wealth of information as well. And I know they field quite a few questions. Again, this is what you'll see. So when you, the Narcan follow-up, so if you do use your Narcan, you save a life, please report it. We love those stories, knowing that, you know, this Narcan is really helping the community and people's lives are being saved. And it will also help us to show the federal government that the money they're investing in the states, teaching overdose prevention, response to overdose, and providing Narcan is making a difference. And I feel like if we can show them it's making a difference, we can hopefully continue to have funding for these programs. So now if you would take just a few minutes, and we'll pause, I'll give you maybe just about 3 minutes to please take the post survey, the post training survey. You'll show this slide to your participants, and you can tell them they can either just go to the website or they can go to the URL and scan it with their phone. They can just go up to the right-hand corner to find surveys and then take the post training survey. And again, these survey results really help us a lot to show the state that we're, you know, working to teach people and to get the Narcan out there. So if you would take just 3 minutes and complete that, we would be very grateful. Okay, great. Hopefully everyone's had a chance to complete the survey. We really, really appreciate it. Let me forward. Again, here's the QR code. So as mentioned before, please feel free to reach out to us. We really appreciate you taking part in our first virtual Train the Trainer event in Texas. It's been a lot of fun. As we part, I want to share with you the 2-minute animated video we created that is available in both Spanish and English. And I think, oops.
This information is brought to you by Team Cleveland at UT Health San Antonio School of Nursing. We're able to provide this training and free Narcan to all Texas residents through funding support we received from the Texas Health and Human Services Commission. So if you know someone using either prescription or illicit opiates who may be at risk for overdose, you really need Narcan, and you can order it here for free in Texas. Here's everything you need to know to jump into action. You suspect that someone has overdosed. First, try to get the person's attention by firmly rubbing your knuckles up and down the center of their chest. Next, call 911 and give them your location and the person's symptoms. Then it's time to administer Narcan, a nasal form of naloxone. You're about to save a life. Peel open the package to remove the Narcan device. You seriously can't mess this up. Just pretend it's allergy nose spray. Now, place the nozzle tip into the person's nostril until your fingers touch the bottom of their nose. Then, press the plunger firmly to release the dose. You just completed the most important step. Okay, now, check to make sure you're still breathing. Next, place the person on their back and tilt up their chin to clear their airway and help them breathe. Give a second dose of Narcan in their other nostril if the first dose doesn't wake them up within 2 to 3 minutes. Make sure you provide care for the person by rolling them on their side after you've administered Narcan until EMS arrives. Maybe pat their back so they know you're still there. Remember, they may be really scared and not feel well when they wake up. Make sure you stay with them until medical help arrives. You never know, this life-saving experience may just be the nudge this person needs to get into treatment and recovery. People recover from addiction every day. It's not easy, but it can be done. But you have to be alive for treatment to work. Look at you. You just may be the first step in this person's recovery journey. Yay you! Great job. And always remember, just keep breathing. We'd love to hear about the life you saved at www.morenarcanplease.com. You can report it here confidentially, and at the same time, order your replacement dose of Narcan so you can save more lives.